Hi, my name is Rachel.
And I'm Noelle, and we believe that coenzyme Q10 supplements are beneficial for individuals with cardiovascular disease.
According to the Centers for Disease Control and Prevention, cardiovascular disease is the leading cause of death for men and women in the United States. Cardiovascular disease refers to a number of conditions that affect the heart or blood vessels. This can include coronary artery disease, high blood pressure, congestive heart failure, or stroke. Given the high prevalence and wide-ranging effects of cardiovascular disease, there is a need for further prevention and treatment options. Coenzyme Q10, also known as ubiquinone, functions as an energy transfer molecule within the electron transport chain. It aids in oxidation reduction reactions, helping to synthesize ATP. It is commonly found within tissues that have a high rate of metabolism, such as the heart, kidney, and liver. Since coenzyme Q10 acts as a lipid antioxidant, this molecule has been investigated for its role in preventing and treating a number of diseases. In addition, as age increases, the endogenous production of coenzyme Q10 decreases. This endogenous antioxidant has potential for use in prevention and treatment of cardiovascular disease, particularly hypertension, hyperlipidemia, coronary artery disease, and heart failure. Oxidative stress is an underlying factor in the development of cardiovascular disease. This is one of the reasons why coenzyme Q10, a strong antioxidant, has been studied for its effects on this condition. The main dietary sources of coenzyme Q10 include oily fish, organ meats such as liver, and whole grains. There is evidence that supplementation can be beneficial for individuals suffering from a medical condition such as cardiovascular disease.
A review article published in Current Cardiology Reviews reports that 3 out of 4 patients with heart disease have low levels of coenzyme Q10. It was also found that coenzyme Q10 levels decrease in proportion to disease progression. These results are consistent with other research findings that the heart tissue in cardiovascular disease patients has been shown to be deficient in coenzyme Q10. In another review article published in Pharmacological Therapy, the authors explain that cardiac cells are very sensitive to low levels of coenzyme Q10, and supplementation can improve cellular activity. This review article explains that in patients given 60 to 200 milligrams of coenzyme Q10 daily, there was significant improvement in clinical, laboratory, and exercise levels. Since hypertension increases the risk of cardiovascular disease, a randomized double-blind placebo-controlled trial evaluated coenzyme Q10's role in reducing high blood pressure. The study found that after 12 weeks of supplementation, participants with high blood pressure experienced lowered systolic blood pressure to within the normal range. Furthermore, a randomized double-blind multinational placebo-controlled trial analyzed whether coenzyme Q10 supplementation resulted in improved outcomes for chronic heart failure patients. Participants were given 300 milligrams of coenzyme Q10 daily or a placebo, along with traditional medical treatment. Participants were followed for 2 years. The results indicated that participants taking the coenzyme Q10 supplements had a significant improvement of 6% in left ventricular ejection fraction compared to controls. In addition, the amount of cardiovascular deaths was lower in the experimental group compared to the control group. A randomized double-blind trial found that the long-term use of CoQ10 improves the symptoms and reduces major adverse cardiovascular events in patients with chronic heart failure. So to conclude, more research is needed. However, based on the current research that we looked at, there is evidence that supplementing with CoQ10 can benefit cardiovascular disease patients.